Chapter 28, Treatment of Prostate Disease and Erectile Dysfunction. The prostate gland is part of the male reproductive system located just below the bladder that surrounds the urethra. The gland produces semen, the fluid that contains sperm. Prostatitis is an inflamed or infected prostate gland. Symptoms may be burning on urination, fever, body ache, groin, rectal or low back pain, difficult urinating, urge incontinence, painful ejaculation, and decreased libido. Although some of the symptoms are similar, prostatitis is usually an acute condition, unlike benign prostatic hyperplasia. BPH is a condition in which non-cancerous cells in the prostate grow and increase the size of the prostate gland. It is a condition associated with bladder obstruction and lower urinary tract symptoms because as the gland grows, it begins to obstruct the flow of urine throughout the urethra. The urethra is a small tube that carries urine and semen through the penis. So you can see figure 28.1. A is a normal prostate. B is an enlarged prostate. So here's the normal prostate. Here's the enlarged. You can see it is much bigger. And looking at the urethra, it does run from the bladder all the way to the end. And there is some medications that are given into the urethra. So it would be inserted through here and it would run through the prostate into the bladder. The risk for developing BPH increases with age. By age 60, more than 50% of men will have the condition. 90% or more men will develop BPH, LUTS, by 80 years old, and nearly all men will have an enlarged prostate. A digital rectal examination involves the insertion of a gloved finger into the rectum and palpating the prostate to determine whether if it is enlarged or not. A prostate-specific antigen test, PSA test, may be performed to determine whether levels of the PSA protein are elevated. A higher than normal level is a sign of BPH, infection, inflammation, or prostate cancer. A free PSA test, the percentage of PSA that is not attached to another chemical, may be conducted to differentiate between BPH and cancer. Free PSA is linked to BPH but not to cancer. Urinalysis and a biopsy of prostate tissue may also be taken. The first symptom of an enlarged prostate gland is a weak or slow stream of urine. There may also be a delayed start in the flow of urine or straining to urinate. As the disease progresses, the bladder becomes hypersensitive and the need to urinate becomes more frequently, so urinary frequency. Some men can develop urinary infections from the condition, and BPH may also produce bladder stones, sudden inability to urinate, or kidney damage. Box 28.1 shows symptoms of benign prostatic hyperplasia, some of which we already talked about, but need to strain to urinate, weak or slow stream of urine, delay in starting urination, frequent urination, urinary urgency, and nighttime awakening to urinate. Pharmacotherapy for BPH is initiated when symptoms are uncomfortable enough to warrant treatment. Watchful waiting is recommended when patients are asymptomatic or symptoms do not produce much discomfort. Alpha blockers and 5-alpha reductase inhibitors may be administered to manage symptoms. So figure 28.2 shows the summary of treatment options for benign prostatic hyperplasia. Alpha adrenergic antagonists relax prostate and bladder smooth muscle, which reduces urethral resistance and improves the flow of urine. Some alpha blockers are also prescribed for the treatment of hypertension, which we talked about in chapter 18. A common ending for 5-alpha reductase inhibitors is steroid. Alfuzosin, doxazocin, Silodosin, tamsulosin, and terazosin bind to alpha-1 adrenergic receptor sites. Binding to alpha-1 adrenergic receptors blocks adrenergic-mediated vasoconstriction in the prostate. Alfuzosin, doxazosin, and tamsulosin are available in extended-release dosage forms and dosed once daily. The half-life for all agents ranges between 10 and 22 hours. Absorption of tamsulosin is increased if the drug is taken with high fat content meals, increasing the effects and side effects. Rapaflow should be taken with food. Urine flow rates are usually improved within the first 2 weeks of therapy. So we have this table, alpha-1 adrenergic antagonist, which we just talked about. And then we have all the dosage forms and strengths on this side of the table. See, all of those are just tablets and capsules, tablets or capsules. High testosterone levels can stimulate growth of prostate tissue, whereas deprivation results in a reduction in glandular size. Finasteride and dutasteride inhibit 5-alpha reductase, an enzyme that controls the production of dihydrotestosterone, DHT, from testosterone. Drug effects accumulate over time, and it may take 6 to 12 months for full therapeutic effects to be achieved. Finasteride 1 milligram is prescribed for the treatment of male pattern baldness, and 5 milligram is usually given for BPH. Dutasteride and finasteride may decrease desire for sex, cause ED, and or reduce semen volume. Both drugs are harmful to a developing fetus, so therefore pregnant women and women of childbearing age should be advised to avoid contact with broken or crushed tablets. The use of a barrier contraceptive such as condoms is also recommended. It's important to know that this medication probably should not be handled either by someone working in the pharmacy that is pregnant without gloves. So we have the table here of 5-alpha reductase inhibitors. And then you can see here at the bottom, we have a combination capsule that is called Jalin, and it has both of those medications in. It has dutasteride and tamsulosin. And then we have just our finasteride, again, 5 milligrams, which is Proscar, is used for BPH, and usually the 1 milligram is used, Hyperplasia is used for male pattern baldness. When symptoms of BPH are severe, surgery is indicated. There are several surgical options. Some procedures can be more invasive than others. Now we have the summary of drugs used in the treatment of benign prostatic hyperplasia, all of which we've talked about that are in this list. So some of the warning labels: do not discontinue without medical supervision, may cause dizziness or lightheadedness, avoid driving or operating hazardous machinery. For Flomax, Cardura XL, and Uroxetrol, you should swallow whole, do not crush or chew. And with alfuzosin and silodosin, you should take with meals. For dutasteride, you should not chew the capsules, which I would hope no one would, but you should swallow whole. For finasteride, swallow the tablets with a drink of water. And pregnant women should avoid contact again. For Jalin, we have may cause dizziness, swallow capsules whole, do not chew, and pregnant women, again, should not be in contact with broken or crushed tablets. An erection occurs when the arteries and sinusoids in the corpus cavernosum fill with blood. Intracorporeal blood pressure increases while at the same time venous outflow decreases, resulting in penile rigidity that enables effective intercourse. ED is defined as the total inability to achieve erection, an inconsistent ability to achieve erection, or difficulty maintaining erection long enough to sustain sexual intercourse. It is also known as impotence, and right now up to 30 million American men have reported symptoms. ED appears to increase with age. However, it is not an inevitable part of the aging process. By age 40, approximately 5% of men experience ED. By age 65, approximately 15 to 25% of men have ED. And figure 28.3 is just the structure of the penis and all of the different anatomy parts. ED may have physiological, psychological, neurologic, or endocrinologic causes. Physiologic causes include age-related changes in chronic disease like hypertension, hyperlipidemia, or multiple sclerosis. Neurologic and endocrinologic causes may be the result of diabetes, a disease of the endocrine system, and ED can also be caused by depression. And there's some life factors such as obesity, smoking, and alcoholism that can contribute as well. ED is managed by the administration of drugs that promote penile engorgement and slow loss of erection. Neurotransmitters are involved in producing an erection. So box 28.2 shows the neurotransmitters that relax smooth muscle in the penis. Nitric oxide is a mediator of smooth muscle relaxation that is released in response to sexual stimulation. Sildenafil, Tadalafil, and Vardenafil are the most commonly prescribed drugs for the treatment of ED. They are taken prior to intercourse to produce an erection. Sildenafil and Tadalafil are taken 30 minutes prior to intercourse. Vardenafil is taken up to 60 minutes before sexual activity. Vanafil, Sildenafil, Tadalafil, and Vardenafil relax smooth muscles and blood vessels that supply the corpus cavernosus and control penile engorgement. At the cellular level, the drugs increase levels of nitric oxide in the corpus cavernosum, which blocks the opening of calcium voltage-gated channels and reduces calcium-mediated vascular contractions. The oral absorption of these medications is good, and maximum concentration and onset of action of vardenafil are reached between 30 minutes and 2 hours after the drug is administered. Tadalafil and sildenafil are similar, averaging approximately 2 hours. PDE5 inhibitors are involved in numerous drug interactions. A life-threatening drop in blood pressure has occurred in men who have taken nitrates, such as nitroglycerin for angina. So the use of nitrates in all dosage forms is contraindicated while taking PDE5 inhibitors. Concurrent administration of alpha adrenergic agonists used for the treatment of BPH requires caution, and it is recommended that they are not taken within 4 hours of PDE5 inhibitors. Patients taking PDE5 inhibitors should avoid antifungals, cimetidine, grapefruit juice, macrolide ineffectives, excessive alcohol consumption, and drug interactions have occurred with co-administration of selective serotonin reuptake inhibitors and monoamine oxidase inhibitors. So in this table, we have phosphodiesterase inhibitors, the PDE5 inhibitors. The first drug, Avanafil, is only available in the US as Stendra. Sildenafil is available in the US under Viagra and Revatio. There is a solution, an oral solution for Revatio, and an IV solution for Revatio, also a tablet. Viagra is only available in a tablet. So oops, went down too far. The Revatio is actually indicated for something related to the heart, and that's how Viagra came about during clinical studies for sildenafil. They found that this medication did something else, and that is how we got Viagra. We have Tadalafil, which is Cialis and add Circa, and then Vardenafil, which is available as Levitra and Staxin. L-prostatyl is naturally occurring prostaglandin E1 present in the seminal vessels and cavernous tissues of male. It can also be found in the placenta of the fetus. PGE1 mediates the relaxation of penile smooth muscle. The oral absorption of L-prostatyl is poor. Therefore, the drug is formulated for intraurethral insertion and intracavernosal injection. So this is the medication I was talking about earlier when we looked at that structure of the penis with the urethra. That's how the medication is administered. The intracavernosal route of administration is more effective, though, than the intraurethral. And box 28.3 lists the instructions for administration of intraurethral pellets. Box 28.4 has instructions for administration of intracavernosal injections. And we have prostaglandins, L-prostatyl. So we have these brand names: Caverject Impulse, Edex Cartridge, Muse, Prostin VR. Caverject is the powder for injection. Muse is the urethral insert. And Prostin VR is the injection solution. ED may also be treated by attaching a mechanical vacuum device to the penis, which uses suction to produce engorgement. An alternative approach is to surgically implant a device with inflatable tubes that can cause the penis to become erect. Vascular surgery may be performed to reconstruct arteries that supply the penis and to block off veins that allow blood flow to leak from penile tissues. So we have summary of drugs used in the treatment of erectile dysfunction, the phosphodiesterase PDE5 inhibitors. As we talked about before, they may cause dizziness. We should avoid grapefruit juice when taking with Avanafil, Tadalafil, or Vardenafil. If you're taking the Levitra oral disintegrating tablets, those should go under the tongue. Then for prostaglandins, the Muse should be refrigerated, but it can be stored at room temp for 14 days after use. Caverject, make sure you're rotating the site of injection, and that can be stored at room temperature for up to 3 months. And avoid drug exposure to extremes in heat or cold. And then we have just herbal remedies for benign prostatic hyperplasia and erectile dysfunction. The ripened fruit of saw palmetto contains fatty acids and plant sterols that inhibit 5-alpha reductase and systolic androgen binding, producing anti-inflammatory and anti-estrogenic effects. Saw palmetto may reduce urinary symptoms of BPH. Prostate cancer should be ruled out prior to taking saw palmetto. Yohimbe is an evergreen tree found in West Africa. Its bark contains an alpha-2 adrenergic blocker related to reserpine that may improve ED. Clinical trials have not been conducted, and evidence to support Yohimbe's effectiveness is lacking. Adverse effects include increased blood pressure and heart rate, headache, insomnia, anxiety, nausea, and vomiting. And drug interactions can occur if Yohimbe is taken concurrently with MAOIs, TCAs, and phenothiazines.